Hello, my name is Dr. Brian Trautman. I'm a chiropractor and this is my office, Mount Pleasant Chiropractic Rehab. I'm going to show you a little bit about our office today. I'm also going to show you a couple health tips on shoulder issues and shoulder conditions. So follow me. This is our patient success stories. We got a bubbler here. Lots of fun in this office. This is where I adjust my patients. Okay. Got some fun pictures in here of some of the kids that I adjust, including my little girl Claire. Kind of fun. So, shoulder issues, okay? I see a lot of patients with shoulder conditions, and they can happen from a lot of different things, like, a car accident, a problem that's been there for a long period of time, or it can happen from things like, sitting behind a desk and typing on a keyboard, and all the things that we tend to do are always in front of us, okay? So we tend to have a lot of muscles in the back to get really, really tight, and these are the ones that pull the arm pretty much out of its socket, and eventually what it does is it creates a bad posture, and these are all the things that would affect the shoulder and over time would have a hard time with using the shoulder, like lifting and bending and twisting, and eventually you get things like numbness and tingling and weakness going into the arms. So I'm going to show you a couple exercises today to help stretch some of those really tight muscles that cause that bone here to misalign. Okay, we find that in the shoulder that a lot of the internal rotator muscles get really, really tight, and they're really big ones, like the pectoral muscles and the lat muscles. So I'm going to show you a couple stretches to help stretch them. Okay, the first one is a muscle to the front over here called the pectoral muscle. You're going to find yourself a nice doorway, nice and easy. Contact that doorway like this and rotate to the opposite side like so. You want to make sure that you're stretching these muscles in the front part here. Hold it there for about 20 seconds. Do that about 3 times. You can raise it up, increase the angle a little bit more. Same thing. And take a lower angle, same thing. And do both sides. You may have a shoulder condition on the left side, but do both sides because it gets better twice as quick. It trains the brain to function much better. That's the first exercise. Nice and simple, nice and easy. Second one revolves something like this, like a bungee cord or a piece of elastic like this, rubber. You can use a towel, you can use a pole. I use my hockey stick. I used to play hockey, things like that. Very easy exercise. Go like this and all the way backwards. It's stretching a lot of those strong internal rotating muscles. And when you get better and better at this, you can hold it closer and closer. Stretches them, promotes a better posture, standing taller. It undoes the effects of sitting for long periods of time, whether it be, let's say, in traffic, riding a truck or being behind a desk. Also, what I tend to find with a lot of patients is that when there's a shoulder issue, there tends to be usually misalignments in the upper part of the back and in the neck area. Okay, when there's an injury to an area, your body wants to get in a position that's more comfortable for it, so it leans away from the site of injury. Okay, and before you know it, your posture gets altered and distorted. Short term, it feels a little better, but long term, it's not the best for your nervous system, and the nervous system powers the body. So what I find with adjusting patients, it helps to get rid of the cause of the problem. They're standing straighter, they're stronger, better nerve energy goes to those muscles that tend to be really tight. When a nerve gets pressed on, the muscle gets tighter, and when it gets tighter, it's not going to be as strong, it's more prone to injury. And that's when we see things like, impingement syndromes with patients. We see things like, adhesive capsulitis with patients. We see all sorts of different types of issues like frozen shoulders with patients. And it's pretty simple. I show a lot of rehab exercises. I'll adjust their spine, let the body kind of heal itself. Okay? Now with doing these exercises, if you feel it's a little too much for you, consult me. Or you want a little more information about that, same thing. My name is Dr. Brian Trautman. I'm at 262-633-6325, or if you're in the Racine area, 633 neck. Okay? I'm looking forward to seeing you here. Take care.